Good morning or good afternoon, everybody. Today I'm pleased to introduce you to a briefing by the H-ISAC. My name's Tony Kitzel. I'm the Chief Information Security Officer for the Australian Digital Health Agency. Today I'm joined by two colleagues, Rob Atherton and Brad Watson from the Australian Digital Health Agency, and my colleagues from the United States, Selwa and Erool. I'll just introduce our two international colleagues. Selwa, could you just do a quick introduction of yourself, please?
Absolutely. Hey, good morning, good afternoon, everybody. Salwa Rafi. I'm a Vice President with H-ISAC, responsible for our global business and development. Pleased to be here. Erool?
Hello, everybody. My name is Erool Weiss. I'm the Chief Security Officer at H-ISAC, and I'm responsible for running our Threat Operations Center and several other member-facing services.
Excellent, thank you, Erool. Well, today, folks, we're going to have a quick conversation about the H-ISAC. Today's presentation will walk through a community of practice approach that the H-ISAC and the Australian Digital Health Agency are bringing out to the Asia Pacific region. We're really proud to partner with the H-ISAC out of the US. We're a firm believer that cybersecurity is a team sport, and at the agency we realise that our success is a shared success that we need to actually undertake together as a true community of practice. Today's presentation will talk to you about the experiences that the Australian Digital Health Agency has with the H-ISAC, our understanding and benefits that we're getting, and then we're going to hand over to our colleagues in the US who are going to talk about the real world benefits of being a member of the H-ISAC. Today's presentation is aimed to give you the necessary information available so that you can make an informed business decision about joining the H-ISAC. I'm hoping at the end of the presentation you'll have more than enough information to see the value that we at the agency see and take advantage of this unique opportunity. So security in healthcare, as we know, is a foundation for digital health. I don't think there's any of us working within the health sector that don't realise that the digital ecosystem that we're connected into is unique and is a massive piece of fabric that touches right away from the small pharmacies operating out in Western Australia to healthcare providers at the front line in rural Queensland or rural New South Wales or Victoria, right up to a large metropolitan public or private hospital environment. Our success is based on that we all work together and develop a shared sort of response to the environment and the way that we keep ourselves and look after the citizen data, which is so critical to the success of delivering healthcare practices. We all know that trust is hard to earn but easily lost, and this presentation today will talk about ways that you can empower your business to take advantage of the H-ISAC, the lessons learned from the Australian Digital Health Agency, and understand why we undertook this journey and reached out and initiated the conversation with our US colleagues. I think it's fair to say, and if any of you heard me presenting previously, I use this analogy often, cybersecurity is the ultimate team sport, but equally cybersecurity is everyone's responsibility. Our approach to how we actually get in and build a security first culture within the digital health sector inside Australia and the broader Asia Pacific region sits with us as leaders within our respective spaces. We are expected to demonstrate best practice skills and expertise and guide our custodians of the data through the necessary journey so that we can deliver a secure and robust health system for our country. Next slide, please. So the Digital Health Agency started this journey, it was probably 5-6 years ago, and we really started out looking at the My Health Records system and building a national platform that could host the 23 million health records for our country. We were really pleased when we got 92.7% of the population to sign up and get a My Health record, but equally more pleased with the opportunity it provided us to truly show leadership in this space and help guide the country to building a more cyber resilient infrastructure to support the delivery of health services. Our strategy for 2025 is based on 5 core tenets. First of all, we believe that the agency has a role to provide leadership and cybersecurity capabilities across the sector. That doesn't mean we're the only leader. Leadership is a joint journey, and that we all, whether we work in the commercial, private sector, public sector, or for federal government like the Australian Digital Health Agency, we all have a role to provide leadership. And we think also that the function that the H-ISAC will bring to you and the tools necessary will be able to give you those skills to demonstrate leadership within your respective organisations and show the real world impacts of cyber against the delivery of health services. The second core tenet, I think this is my favourite, is that it's work as one, and that is leverage and strengthen relationships across the domestic and international partners so that we can actually provide a unified cybersecurity service in Australia. I'm a firm believer that if somebody's doing something well, we should emulate that and copy that great work and actually effectively take on the lessons learned from those partners. And by working as one, we have this advantage. This is the core benefit of the H-ISAC, is building this true community of practice. The agency has realised earlier on, we're a small organisation, we've got about 500 folk. My cybersecurity team is a reasonably sized team, but we're not big enough to be everything to everybody. But the success and the secret to making a real impact in this space is by working with others to be successful. And that's why the agencies adopt an approach of partnering where possible, so that we can leverage commercial partners out there in the sector who can provide us guidance and leadership. We can work with the H-ISAC to work as one. We can work with the Global Digital Health Partnership Program that Australia was the inaugural member back in 2017. These are all things that help us as a community of practice start to drive and move the needle. The agency also understood that it needed to establish a cybersecurity centre of excellence. A centre of excellence doesn't mean that we are the be-all and end-all to cybersecurity, but it does mean that we know where the ends of the cybersecurity spectrum are and where to leverage cybersecurity excellence wherever it exists. If that's a hospital, public or private hospital providing unique cyber services, the agency wants to be able to use a cybersecurity centre of excellence to reach in there and bring that expertise and guidance out to the larger health organisations. But equally, it's finding partners in the private sector, for example, the software vendors we know are going to be watching today's presentation, who have a unique opportunity to build clinical information systems that are really state of the art. And by developing a cybersecurity centre of excellence in both a digital format and a way to provide governance and leadership, we'll all be able to move the needle in regards to building a centre of excellence across the health sector where we all participate in our different capacities. One of the other things that I think is really important to draw out is early on we realised that when we were delivering our cybersecurity practice and trying to bring best part of 17 million people onto the My Health record, that we needed to do a lot of work around education and raising the level of cybersecurity maturity across the sector. Now, whether that was simply just getting out there and providing education services, which we undertook a massive campaign on, but also the ability to sit down and say to all of our stakeholders, you play a critical part in delivering a national program. We all know that the My Health record is considered national critical infrastructure by default because it delivers digital health services for the entire country. But equally, the parts that you present and connect into the My Health record system and the broader ecosystem are so important to being successful that we need to ensure that resilience is raised within your respective sectors. If one of us fail, we all fail. If we break trust with our stakeholders, we all lose trust. And we all know that if we lose trust of 1% of the population, and then 1% of those people end up in an emergency room and don't have access to their digital health records, lives could be lost. And that sits on us as experts within our field to do something about. And resilience is the only way to actually build a sustainable system where trust can be protected. The last pillar that we truly believe this is the space that all of you on today's presentation will be able to help us with, is for the agency to leverage innovation. We are not the innovators of the world. We're here, we are extremely good at what we do, but we look for the private sector to provide innovation and leadership and actually help us understand what new and emerging technologies are out there that are hitting the coalface of healthcare services. What new Internet of Things are about to roll into the medical world that we need to be aware of, and how do we integrate those new innovative technologies into our solutions? We know that cloud is right around the corner for all of the health sector. Everybody in other sectors has been talking about cloud for the last 5 years. In health, we're now talking about the role of cloud and delivering an elastic health service to the country and to provide something that can scale to meet demand. So this is where we need your help. Simply put, we expect that you will provide leadership and innovation. You will bring to the sector a different view on what is the art of the possible and how can we bring these skills together and these new capabilities. My daughter always says to me, Dad, why can't I have a Fitbit experience where I connect my data from my Fitbit into my Health record? Well, I'm hoping that our private partners out there in the software industry and the developers of clinical information systems and the people at the coalface will actually listen to that and understand the importance of bringing innovative technologies into the health sector so we can continue to enhance and drive the overall agenda. This is an area that the H-ISAC will provide unique input into, and Erool and Sal will talk about this shortly, about the councils that have been established around bringing innovation and technology into the sector. And I hope, and I look forward to actually hearing about it from them, but I hope you get as much out of the presentation as I did when I looked at the great work that's been done over there. Next slide, please. Okay, so I'm going to hand over to Selwa and Erool. I'll let them present through on the HISAC, and I'll come back and join at the end of the call. Thank you.
Right. Thanks, Tony, for the kind introduction. So, introducing the concept of the HISAC, which stands for Information Sharing and Analysis Center. We are a member-based organization. We are a global organization with our members, and our objective is to share threat intelligence and increase the resilience of the health sector. I think, as Tony mentioned, there is the year 2020 has proven that there is no more critical infrastructure industry than healthcare. And so we unite for the healthcare industry, for the health sector, under the umbrella of the National Council of HISACs that includes many HISACs, each of them geared towards another industry that would constitute a member of the national security in any country. We focus on the global healthcare and life sciences. And again, our mission is to prevent, detect, and respond to both cyber and physical threats. We empower our members and we make sure that our sector is very resilient. Next slide, please. So when our members join us, like the Digital Health Agency as an example, they have an instant 4,500 global security analysts added to their security teams. These members will work for you, will work with you. In case of any incident, they will share what they see in their environment, in their countries, in their geographies. As you see, the red dots represent all of our members. We are covering North America, Europe, Asia Pac. As you see, Australia there is in the center of our leadership within the Asia Pac region, and we are expanding very heavily. We have all of the sectors and the subsectors of the hospitals, pharma companies, biotech, private public sector partnerships. So we welcome everybody to join our membership. Next slide, please. If you look at the membership mix for this year, you'd see the largest portion of it is the providers and the clinicians. And we are scaling up and down. It goes all the way from the smallest family practice, dental offices, imaging centers, all the way to the multi-campus global healthcare providers. And this is followed by the insurance companies, the payers organizations, followed by the med device manufacturers. Of course, we have pharma, biotech companies, small and large. We have the HIT companies providing solutions, applications, and technology to the center, to the sector. And then we also welcome academia, research centers, university hospitals to join us, followed by the pharmacies. Some of the pharmacies are big enough to have and carry sensitive medical and clinical information within their e-prescription. So they also want to see what's happening in the cybersecurity world. Next, please. This is a picture of our SOC in Florida. And so we have dedicated security team under Erool's management. And Erool, would you like to say a few words about the reporting and the dedication of the team to share with the members?
Yeah, thanks, Salwa. Yeah, so just to build upon that, the group that we do have in Florida, we have operating our Threat Operations Center. And really, I look at that as the center of collaboration for our members. So it's really about being able to help our members share threat information with each other, but then also really help foster that collaboration and cooperation amongst those members as well. And we're going to go through this in a little bit more detail later on, but we have a number of ways where the members can collaborate online, share intelligence information, share threat intelligence, incident information with each other as well. And our team is also there to help with some research and analysis, and then help take that information and then distill it down to other alerts and advisories that we're able to share with the rest of the membership. So on the screen that we're showing there right now, you can see some examples of some of the daily reports that we're pushing out today, some of the cyber threat and vulnerability bulletins that we publish, We also keep up to date a threat landscape level for the sector itself. So we're constantly monitoring what the current threats are and providing some remediation and countermeasure support for that as well. And then some of the other deliverables that we have, there's an example there of that CVE weaponization report. So the idea there is, of all of the new vulnerabilities that are being released and talked about online, which ones are actively being exploited by underground criminal, cyber, malicious actors today, which ones do you really need to pay attention to? So that helps you prioritize your patches, for example.
Thank you, Erool. Next slide, please. So with the intelligence and operations, like Erool mentioned, we have many examples here of the reports that we push out to our members. And Erool, as a continuation of your description of these reports, if you keep pressing, we would see examples and screenshots of these reports. Erool?
Yes, sir. Yeah, sure. Thanks, Hala. So yeah, here comes some examples. So on the daily cyber headlines, for example, the idea with this report is to share the last 24 hours worth of global cyber events that could be an impact in your organization. And so these are meant to be very healthcare sector specific issues that we're dealing with. And then more importantly, as you can kind of see in the background there between the summary and then the analysis section, the idea there is to try to express why is this important to the individual as a health IT or an information security professional in the healthcare sector and what to do about it. So, that's the idea with that report. So if we click ahead one more, we should see, it looks like the nation state example. And if we keep going, there's an example of the physical security updates that we do. So again, that's another example of a daily report that we're providing. Keep going. Okay, and here's some, and actually those slides were actually examples from the monthly threat landscape briefing that we do. So we do those at the last Tuesday of the month and provide updates on various topics, including nation state, physical security, legal and regulatory, again, from a global perspective, plus cyber threat and criminal threat updates as well as part of that threat briefing. Okay, let's keep going. All right, and the next slide.
Yeah.
Hala?
Okay, thank you, Erool. So, as Erool mentioned, we focus on both cyber and physical. So we send these reports that is geared towards improving the security posture of our member organizations. We provide situational awareness. We provide geopolitical landscape. The physical security can be natural disasters, political unrest, any terrorist organizations that we want to report on, or any breakage in the supply chain of medications and medical devices. Any one of these would disrupt the health services for our patients. We crowdsource the cybersecurity expertise, and we talked about over 4,000 security analysts will be crowdsourced to help you with your organizations. We focus on guidance and regulations of medical devices, and of course, for the entire health sector, for the privacy part, whether it's Privacy Act, GDPR, HIPAA, and also the regulations for the medical devices and the drugs. We talk about risks of emerging technologies and examples of that, all of the AI, machine learning that has been part of the cloud adoptions, the security innovation, what quantum computing would add and completely change our security landscape. Tony mentioned about his daughter having the Fitbit and how this data can be added to the health records. And if you recall, the Amazons and the Apples of the world has already started having these partnerships to have the data from the smartwatch and the Fitbit all part of our medical records. The idea here is to forge a community of trust and resilience as we share best practices and we share what we see. Next slide, please. And we provide also a customized dark web surveillance to our members. Erool, do you want to say a few words about this particular service?
Yeah, sure. So there's a lot of things that we do. Here's just one example of the services that we're providing to the members. under the name of this Bimeta service. So the really interesting thing here is, again, this is service that we include with the membership. As I go through this, many of you may recognize that there are some commercial offerings for this. So this is a very high value item for our members. But the idea here is that you can register the domains that are associated with your firm, your company, your enterprise. And we will constantly look for similar domain registrations. So if someone attempts to do a typo squat domain or even a similar sounding name domain, you will get an alert for that as well. The next item talks about leaked credential detection. So the idea here is if a username password combination is captured by malware that we have access to monitor, and that username has an element of your domain in that username, where many people use their email addresses, for example, we will also send alerts for that as well. And that service on the credential detection, I think we've got about 50 billion username password pairs. So that database is quite large and constantly being updated as well. There's also updates that we do there and other searches that we will do looking for other online sites such as Pastebin or other dark net markets and underground criminal forums, looking for similar information associated with your domain. And again, it's all provided as part of the membership.
Thank you, Erool. Yes, as you mentioned, this can be just a commercial provision, and we provide that as part of your membership. So the ROI on joining our organization is extremely positive, if I may say. Next slide, please.
Hey, Selwa, it's Tony. I might just jump in there. So from my benefit of the Australian Digital Health Agency, working with our Cybersecurity Operations Centre, we've already seen a really direct and immediate impact on getting access to the information from the H-ISAC. We use large commercial providers to provide us insight into the health landscape and the risks associated with cyber around the environment. And we're already seeing from our perspective that our investment with your organisation is returning tenfold the level of insight into what's actually going on, and we're paying with a commercial provider. Now, I know it's a balance. We always need our commercial partners, but the H-ISAC data feed and the information available is simply overwhelming on the amount of stuff that's out there in the community of practice. Only recently I was sitting down looking through the app and looking at all the conversations going backwards and forwards between all the partners, and actually talking about real world examples of when threats were weaponized up against an environment and sent in, and how people were responding to it and blocking it and sharing that expertise. So from my experience, that's been a really awesome investment that we've got back immediately. We've only been on board for a short period of time.
And Tony, this is a testimonial that we're very proud of. Definitely. We see that from our members, the sheer volume of services and feeds that we share with them is a lot. And I hope everybody's leveraging all of this information. Erool, would you like to say a few words about the WeSecrets?
Yeah, sure. So the other item of collaboration that I wanted to mention here too is the platform that we refer to internally within H-ISAC as WeSecrets. We do rely on Mattermost for the technology to provide this service to our members. Many of you probably also know one of their big competitors as Slack. Looks and operates very similarly. But the idea here is that we provide online chat and collaboration tool for our members to be able to talk directly with each other and share information directly with each other as well. As Saul mentioned earlier, there's over 4,500 now analysts that have access to this platform. And so when you're in some of these channels, you have quite an audience to talk with and share with and learn from and collaborate with. The list that I have on the left-hand side, I took some examples of just some of the channels that are available inside WeSecrets today. So any of the Health ISAC members that get access to the platform can get access to any of these public channels. I put in air quotes there. And you can see the list there. And so there's a number of, like, for example, there's a number of vendor channels. So if you're using Anomaly or Cyware as an example, and you want to chat with other users that are using that technology, there's a forum there for you. Besides careers and jobs, and then some technology interest areas like DMARC or open source Intel or OSINT. SOAR, so if you're into security automation products and you want to take a look at that too, there's a channel for that. We just added a channel last week for strategic intel. So we have strategic intelligence professionals now that are sharing and collaborating with each other there in that channel too. The screenshot that I have on the screen there was actually from the IOC channel. So indicators of compromise. You can actually see how we share IOCs actively inside that channel there. And then in this particular channel on the back end, we've built automation that will automatically grab the IOCs that are being shared in there and then push them into the automated indicator sharing that we have set up with our members. So we'll talk about that in a moment too, but if you're automatically absorbing any of the threat indicators, that's one of the ways that we get them into that service.
Thank you, Erool. Okay, next slide, please. You know, as Erool mentioned, Cyware is a great mobility platform that would bring all of these capabilities to your smartphone, to your laptop. And you get these capabilities, the intelligence distribution, the information sharing, crisis notification, if anything that is happening within your organization, you get this notification on the spot, incident report, the quick polling, etc. And I think the beauty, Erool, that we see with Cyware is the ability to customize and filter. So each single user of the team can customize, can filter to his or her own interest, whether they want to see just the IOCs coming to a certain geographical area, or maybe just the provider's market, or just the pharma technology. So Erool, what do you think about that?
Yeah, that's exactly right. When I was looking at some of the challenges that we were having when I first came to H-ISAC, you know, I know we needed something to better distribute all the alerts and provide that information to our end users. So I really liked what I saw on the Cyware platform. And you know, as Salwa mentioned, that ability to customize the alerts was really one of the big advantages that I saw. So if you, for example, want the cyber daily headlines, you can turn those on or off. Same thing with the physical security alerts. There's other features and other customization in there that is provided as well. So it's just a great way to do it. And again, just in the very mobile world that we have normally lived in, being able to receive that information on your smartphone or your tablet, or get email notifications and then dive into those alerts as well, it just really provided so much capability for us that we were looking for. And then the last point I'll make here too is on being able to share incident information with us as well. So there's a phenomenal sharing module in here too. So if you're dealing with an incident, you can quickly share the details of the incident through the app. It goes securely to that threat operations center that we talked about earlier. They would do the final bits of analysis and then be able to share that information out to the membership anonymously. And then finally is the document, is the repository, the document repository that I wanted to talk about too. The idea is just having that permanent repository of all the alerts, documents, finished intelligence that we share, and being able to quickly get to that, search for it in the platform, and be able to pull that up so that we're not constantly just looking through our email for that alert that you were wondering about, for example.
Absolutely.
If I can just jump in there. So guys, just as feedback from my perspective, so in 2017, when WannaCry hit the ground globally and impacted health services, if it wasn't for a colleague of mine working in the US in the aerospace industry who called me up at 5 a.m. in the morning and said, Tony, get out of bed, it's about to hit the fan, I wouldn't have had the tools available to actually kick up my team. And back then we were a very young team and still developing. But as a roll-on from WannaCry, the Australian Digital Health Agency is part of, and is the founding member for the Global Digital Health Partnership, actually took the initiative to build, and we actually got a commercial provider to come in and build a mobile app that we could share across 27 countries so cybersecurity professionals could share exactly this type of information. And at the moment, I'm right at a tipping point because I've got a reinvestment opportunity to retake that app and build it up and send it out to the Australian Asia Pacific market. And to be honest, I'm not going to do it. I'm actually going to leverage the H-ISAC Cyware product because it actually gives me the exact functionality. I don't have to invest in it, and I get to contribute to part of a global practice around sharing situational awareness. So for each of you who are sitting out there thinking to yourself, well, is H-ISAC for me? If this is the one thing that could make a difference, as a CISO, getting up-to-date information on my smart device while I'm traveling into work on the bus or at 2 o'clock in the morning when my entire network's down because it's under attack, this is a way that you can communicate and you can build those customized reporting modules. You can make sure that you set it up so that you can share messaging around, this is what we're telling the media about a cyber event, and this is the shared message. These are the IOCs that we're dealing with, and this is the crisis information that my decision makers, my CIO, my chief executive officer need to be able to make an informed decision. So I'm pretty confident that if you're building software and your clinical information system comes under attack, your CEO is going to be reaching out and wanting information. Why rely on Google to go and get it when you've got a partner organisation like the H-ISAC and the Australian Digital Health Agency that can actually give you real world update intelligence from the coalface as it rolls out, and you can take advantage of that. So I'll hand back to you, but this I think is an underestimated opportunity for all of us in Australia to take advantage of.
I completely agree, Tony, and thank you very much. You know, it's we are very happy that you are seeing the advantage and the value. And as you mentioned, just this feature of our membership can pay up for the entire fees and would really constitute a large part of our value to the new members. So thank you for that. Next slide, please. And we are, we always have many councils, committees, and working groups. As part of our quest to foster the trust and the resilience in our communities and the sharing part and the collaboration, we have so many committees and working groups that we invite our members to participate in. And we have very special interests like the payers, for example, pharma, providers, some groups for the software security or the third-party risk governance. We have two very important councils, which are the European Council, the Med Device Council, and now with our presence in Australia, we are very close to establishing the Asia-Pac Council, where we are very proud to have the Australian Digital Health team and agency with us leading through the entire region. So we are inviting everybody to participate in these working groups. We are also big on collaboration on thought leadership. We publish many articles, publications, white papers, and we would like to collaborate with all of you. If you have an idea, if you would like to do some research, we collaborate with you and we publish those with our partners, with our members, and with the vendors as well. Next, please. So the membership, no matter if you are a very small office or one of the largest global pharmaceutical company in the world, everybody has equal benefits. Everybody has an equal seat to the table. There is no limitation on access. You get to have your entire security team to be part of our team and to join our workshops, our summits, our working committees. We have 4 large summits per year, 2 in the US, 1 in Asia Pac and 1 in Europe, and our members attend and participate and speak and learn for free. So all of these events are open to our members. And if you look at the next slide, please. This is to sum up the member events that we have. We keep very busy agenda, and we do local workshops on top of our summits. So the workshops, we can have 1 per country that we can discuss local agenda and local challenges, and as much as global for our summits as well. So very, very soon we will add the Asia-Pac Council to our member events. Next one, please. And the final word here is we are an organization. We want to be a forum that is built on trust. Our communities is built on trust, that everybody, each one of us will share what they see in their environment. They have no fear, whether you are on private or public channels. You are there because you are amongst friends and committees and communities that would help. So this is really the final word. And Erool, if you would like to say something as well about the the core values of our organization.
Yeah, just to build on what you said, and actually what Tony said also when opening up the call, really our foundation, being able to share information with each other really does rely on that trust. And it's just such a valuable commodity for us. And I hope that we are in a position where we can host member meetings again or regional meetings and start building those relationships, build those friendship networks out, and get people to the point where they are comfortable sharing threat and vulnerability and incident information with each other, and trust the fact that it will stay within the boundaries of the information circles that they specify, and then therefore everyone can take advantage of that and learn from each other.
Thank you, Erool. So an open invitation to all of the health sector to join us, and please get in touch with us. We have an esteemed member here that is hosting this session. Mm-hmm. So thank you so much for the Australian Digital Health Agency, and we appreciate your friendship. You're a trusted partner for us. Back to you, Tony.
Thank you, Salwa, and thank you, Erool. So folks, it's truly down to something as simple. Let's partner for success. A couple of weeks ago, we met the Australian Digital Health Agency, and the team from the H-ISAC met with Queensland, New South Wales, Victoria, ACT, the Australian Federal Government Department of Health, South Australia, Tasmania, Western Australia, the Northern Territory, to talk about what we could all do together and provide leadership in the space of cybersecurity resilience for the country. We need your help, simply put. We don't want to do it by ourselves because we can't do it. We realised earlier on back at the agency that partnering across the globe with 27 other governments delivering health services for their respective countries was integral to the success of the agency and our ability to roll out the My Health record. Now it's the next part of the journey where we need to work together, and we all need to start working in building a community of practice. We know that cybersecurity is truly a challenge without borders. The threat landscape changes every day, and anybody who thinks that they know exactly what's going on at every second is fooling themselves. But at least partnering with 4,500 other analysts out there who actually think the same thing and understand what's going on gives you unique insight and ability to actually understand the risk to your system. So now it's time to really think about how do we build resilience across this sector. I'm a firm believer that that's done through collaboration and that the team sport approach is the way to achieve it. So over the next couple of weeks, we're going to be starting to push some communications out about the next steps of the journey. Next slide, please. So 11th of November, we met with the Australian Government Health Services and provided a briefing. We sent a follow-up email out to them detailing the offering and the next steps. Last Wednesday, we started the presentation, but for technical issues, we missed it, but we actually got it out today as a recording. So we're hoping you'll enjoy today's presentation and move through that. So in February 2021, around the corner, just after Santa's been, we're inviting you to join with us in the H-ISAC to a trial period where you can actually have a freebie, look before you buy, go at the service and see what it offers to see if it's truly the value for you. Look, I'm a bit of a Scrooge when it comes to money, and my investment of just over $10,000 US to become a member in the H-ISAC was the best money I spent. My return on investment has already been returned back to me 4 or 5-fold. So have a look at it, jump in and check the services. If you don't, everything that was presented here, you don't think there was enough, there's all these other members that you can reach out and talk to and get their experiences and benefits. One of my dear colleagues in Western Australia, the CISO over there, is actually an advocate for the H-ISAC, and she talks openly about the benefits for her organisation and what they're getting out of it. In April 2021, we're going to launch the H-ISAC Asia Pacific Charter, and this is all about really starting to ramp up the ante in regards to providing resilience for the health ecosystem. In Australia, we need to partner more than just domestically. We need to partner internationally, and our close neighbours in the international region, especially around the Asia Pacific area, are really wanting to be involved and become part of a true community of practice. So now's the opportunity to jump in, get in on the ground floor, because April 2021 we're launching and we're going for gold, and we plan on rolling this out across the Asia Pacific region. My hope is that in the next 6 to 12 months, we've got a couple hundred people representing our region as part of the global community working with the H-ISAC, and we'll really demonstrate the leadership that Australians and people working in the Asia Pacific region can bring to it. We know that all too often we have to do more with less, And I think personally as an Australian, I'm proud of the fact that we really do step up and play the game. We dig in hard and work as a single team and understand that one of us fail, all of us fail. And if we can all succeed together, then we truly do have an opportunity to actually delivering something meaningful for the health sector and bringing digitisation to something that is so dramatically needed to help enable services for our country and our respective stakeholders. So on that, I'm going to finish up. Thank you for this wonderful opportunity to my dear colleagues Selwa and Erool in the US. Thank you for your time and support today, or sorry, this evening in the US, joining us on the call. For Rob and Brad and my team from the Australian Digital Health Agency, thank you for taking the time to listen to this presentation. We look forward to working with you in 2021 to build a community of practice, delivering cybersecurity expertise and leadership across the country in the Asia Pacific region. Thank you and have a wonderful day and take care.